This is Jorge.
Hi.
Looks like we have a quorum. We'll go ahead and get started. I'll ask the board members to introduce themselves first, and then we can have Jeff introduce staff. So I'm Greg Thomas, Boulder County Board of Health President, and this calls to order the Monday, March 8th, 2021 regular Board of Health meeting.
Hello, my name is Jorge de Santiago. I'm the Vice President.
Hi, Morgan McMillan, board member.
This is
Hi,
Brooke
this is
Harrison,
Landry
board
Fagan.
member.
Sorry, Landry Fagan, board member.
And then Brooke, did you introduce yourself?
Oh, sorry, Brooke Harrison, board member.
Thanks, Brooke. Okay, looks like we have all the board members present. Jeff?
All right, I will go through the staff. Mary L. Barron is on the phone. Chris Campbell's on the phone. Sheila Davis is on the phone. Tammy Golden is on, I guess not on the phone, but on the meeting. Bill Hayes, Joe Malinowski, Melinda Morris, Susan Motika, Lexi Nolan, Jana Peterson, Trina Ruland, and Colin Tome. And if I missed anybody, please let me know now, but that's who I have for staff on the call.
Okay. Thank you. So first item up on our agenda is public comments. Tammy or Rita, do we have anybody scheduled?
No, I'm not aware of anyone.
I guess that probably anybody on the line wish to make public comment on an item not scheduled on the agenda.
Yes,
Yeah,
I would like to.
Go ahead.
Yes, I would like to make a public comment.
Okay, so the way public comments work is we have 3 minutes. Please go ahead.
Excuse me, we need to have their name and address for the record, please, and if they could spell their last name.
Okay, my name is Alan Meyer, M-E-Y-E-R, and my address is 245 Coughlin Meadows Road, Boulder, 80302. I'm 75 years old. I'm a retired family physician, an alum of CU, and I'm a member of the Social Justice Working Group of the Netherlands Community Presbyterian Church. And last week, our group sent a letter expressing concern about the pandemic to our 3 county commissioners, and I'm going to read that letter. We are a faith community dedicated to racial justice, and we are saddened by the suffering and death wreaked by COVID-19 pandemic on all peoples. But more than saddened, we are alarmed by the injustice of the markedly different impact of the virus on Boulder County people of color. More cases, much higher hospitalizations, and a higher death rate. Horribly, more people of color are very sick and dying. For instance, as of February 25th, Boulder County Public Health reported people of color comprise 39.4% of the COVID-19 cases in our county, 45.8% of the hospitalizations, and 23.7% of the deaths, despite being just 22.2% of our county population. We want to thank and praise the Board of Health, BCPH, and all the many branches of Boulder County government for their Herculean efforts to control this pandemic, particularly the strategy of leveraging promotores from the Hispanic community has been inspired. However, the rate showing racial inequality noted above have not changed over many months, reflecting the entrenched difficulties facing BCPH and our communities of color, difficulties often the result of ongoing systemic racism. Wonderfully, the arrival of vaccines holds the promise of effective action to correct inequalities. This is an historic opportunity for Boulder County government, and particularly BOH and BCPH, to create a bold plan to immunize our people of color mobilize all available resources in the effort, overcome the oppressive effects of past systemic racism, and erase the pandemic-related racial inequalities in our county. We are confident that our county government and our BOH and BCPH are fully capable of bringing a robust and fully effective vaccination program to our communities of color. We urge you, our commissioners, to immediately direct our county government to execute such a superb immunization program and erase these racial inequities. As citizens of Boulder County, we must also accept responsibility for past injustices. Therefore, we offer you our assistance. If there is any way we can further this vaccination program or help address these inequities facing our communities of color, please tell us and we stand ready to respond. In this vein, we can inform you that our church is making a substantial donation to El Centro Amistad to assist with their relief programs for COVID-affected families. In addition, we are initiating a campaign calling upon other area churches to also address these injustices and match our donation to Amistad. Thank you for your attention to this very pressing problem, the Social Justice Working Group of the Netherlands Community Presbyterian Church.
Thank you, Mr. Meyer, for those comments. And we did receive the board received your letter this morning. So again, appreciate you taking the time to write and let us know your concerns. I suspect that we will probably revisit this in item 4 of the agenda, which is our COVID-19 update. Are there additional public comments?
Yeah, hello, this is Janelle Vale, just like ski resorts. I'm a veterinarian. I was at your last meeting in February and wanted to let you know a couple of things that we've just recently found out about from the Colorado Veterinary Medical Association. They had reached out to CDPHE's Office of Emergency Preparedness and Response, and specifically the volunteer mobilizations. The governor had said that veterinarians could be mobilized to help vaccinate, and we heard back from them that we would be covered under their liability structure and be eligible to get vaccinated if we were volunteering. So I wanted to let Boulder County know that Chapter 5 is a CVMA chapter for the Boulder County area, and we are happy to mobilize. We're able to communicate pretty quickly with our members and can certainly help. If I know at the last meeting you discussed the potential for getting some bigger vaccination sites up and running. So we wanted to let you know that we're here and ready to serve as needed.
Thank you, Ms. Vale. Is there anyone else? Okay, hearing none, we will move on to item 2 of the agenda, which is the approval of the February 8th regular meeting minutes. If there are no call-outs by any of the board members, I would entertain a motion.
This is Morgan. I move to approve the February 8th meeting minutes.
This is Brooke, I second.
Motion and a second. All in favor? Aye.
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 Okay, motion carries. Thank you. Item 3, designating climate crisis as a Boulder County Public Health strategic priority.
Good evening, Greg.
Greg Collin is going to take the lead on this, I believe. And just as a reminder, what we had done is we had planned to come to you in 2020 with this, and then COVID derailed us, and we never did get this on the agenda. I think you all are aware that we have made it part of our strategic plan and have started active work on this, but we wanted to make sure we were closing the loop with you all and bringing this back. And I'll see if Joe or Colin wants to jump in and add to that.
Thank you, Jeff. This is Joe Malinowski, Environmental Division Manager. I don't have anything more to add. We're excited to bring it to you. It's been a year, so it's just wonderful to be able to bring it to you tonight. And without further ado, I'll turn it over to Bill if he has anything to say, and if not, to Colin Toome.
So this is Bill Hayes, and first off, I just want to clarify, Colin does pronounce her last name Tom, and not Toom. And I also want to recognize the incredible amount of work that she has done on this effort for the past several years. And, you know, she's done it with great passion. She has invited partners, invited teams, and listened to solicited input, listened to that input, and in the past year has really focused on not just our strategy to address climate change and the work that we do at Public Health, but also to ensure that we're adding an equity lens to all of the work we do in the climate area. So just really want to thank Colin for all the work she's done. And Colin, have at it.
Thanks, Bill. And I want to, well, I'm Colin Tom. I'm the Climate Action Team lead here. And I first want to thank management for being so supportive, and that's everyone, Bill, Joe, Susan, Lexi, Jeff, you know, really everyone for being so supportive of this. The climate action strategic priority, we're calling it climate action. I know it says climate crisis, but in keeping with the other two strategic priorities, kind of solution-oriented language, where we call it climate action team, and also because that way we can call it the CAT, although not everybody, now the dog people don't necessarily go for that, but so this was an idea that bubbled up from staff, actually, not just in the air quality program, but programs, divisions ranging from strategic initiatives to community and family health. Staff who are passionate about climate change and what it means for the populations that we serve. So it came to a head in 2018 when we received the results of the IPCC report then, the 1.5 degrees Celsius report, and also the fourth National Climate Assessment that were both came out November of that year. And both of them really were quite sobering. And so we began putting our heads together and realized that even though we were in the middle of a strategic plan cycle, this was the time to, you know, the basic takeaway was we have, you know, 10 years to make some major changes and begin, you know, preparing adaptation strategy. So we thought we better get it underway. And we got together a climate action team and we prepared what we are bringing before you today. I know that you've probably seen some of this from us before. Management team has certainly seen it lots of times. I'm going to quickly, Tammy, should I share up my screen, or is it better for you to open the PowerPoint?
Feel free to share your screen.
Okay. I will do that. And I hope this goes well. I had an internet connectivity problem earlier today, so I hope that that doesn't happen again. Can you all see a full-size slide?
Yes.
Thank you. Okay, so we have two other externally oriented as well as internally oriented strategic priorities of health equity and mental health. It was evident to us from the national and global climate reports that climate change is going to affect both of them, and already does. And that was super clear. You may have already seen this animation that's not working from the CDC showing there we go, showing the effects, basically the telescopic effects from the physical changes to the environment to those health effects, including social determinants of health. Here in the West, we're seeing declining reservoirs, capacity, drought conditions, rising temperatures, decreased snowpack, and last summer, wildfires. And I had a slide of wildfires on here. I replaced it with kittens, and then I just thought, forget it, because you all know about that. So the strategies that we've been coming up with as a team and these have been mirrored at other collaboratives, some regional, some state, some national, is that within the public health context, there are three areas. One is awareness, one is adaptation, and one is mitigation. And by mitigation, we mean decreasing greenhouse gas emissions to make the problem less bad. The climate action team members derive from various programs within public health. I've kind of starred the two strategic priorities, and then we have the programs within public health that see themselves as having climate impacted populations served. These are areas that both have the opportunity or both have populations that will be affected by climate change and are being affected by climate change, as well as programs that have the opportunity to provide public service related to adaptation, mitigation, and public information. And so within these various programs, we've held dialogues listening for opportunities within the programs to do this work. And this is really the documents that we are putting for you today came from this process of looking for opportunities where we can, promote awareness, upholding the science, informing the public, doing kind of a coordinated, showing people what's going on, being honest, how we're likely to be impacted, showing them what Boulder County and the government are doing, and then showing them what they can do, promoting adaptation, useful recommendations for how to cope with impacts and how to build resilience within the community. And then mitigation, and within mitigation, as well as in the other areas, we are emphasizing equity of representation and equity of response. Knowing that, and this is well substantiated, that the impacts of climate change are expected to be the most severe upon populations already marginalized by factors from socioeconomic to racial injustice. So we can't do this by ourselves, and we don't have to, because there are everyone is kind of rising at the same time, not necessarily the same rate, but that there are lots of other organizations working on this, even within Boulder County. And I would say most of these groups we have interacted with to some degree. Others we hope to. Oscar is a clear partner due to their climate focus, resiliency also. The county policy team is very much involved in the mitigation side. And county planning and permitting we've come into contact with on the oil and gas, but there are a lot of other opportunities. So this is just an example of some of those partnerships. We have a charter. We finalized that quite some time ago, September 2020. Yeah. So the climate action profile, I'll just show briefly. I want to thank Megan Noel on Strategic Initiatives for helping us to look at how our mission is structured into a profile, and that from there we derive the strategic plan language that we're proposing to you today. So again, just the three basic components of awareness for the public, informing the public and leaders about climate related health impacts, adaptation, increasing and promoting the community's capacity to respond, and mitigation, looking at opportunities to reduce greenhouse gas emissions. And we have a cross-cutting theme of collaboration because so many other organizations are engaged in this work, and we're trying to find the best place that we fit in and how we can promote that work by others. So the work plan for 2021-2022, we know COVID has taken a bite out of capacity for everyone. We do have a work plan. We are actually underway on many of these items here, but we did narrow down on the items, the topics that we felt, for a number of reasons. The topics that best addressed equity concerns, the topics that could best leverage the collaborations that we have going on, and those topics that can actually dovetail with some of the channels that we have created for coronavirus response. And how do we leverage the strength that and notoriety that we've built in public health as a response organization. So the ones we focused on so far are climate and health metrics and data. How do we measure the impact of climate change, and how do we measure the effect of our mitigation and adaptation activities on the issue? How do we measure their success? That's a regional project. It's being worked on by the Metro Denver Partnership for Health Climate Work Group. And so that is, the idea is to develop regionally metrics that make sense regionally. It's also coordinated with a state equity metrics effort. Air quality, the sources of air pollution are also sources of greenhouse gases. The air quality program has a very strong climate focus, and a lot of the work that they do, from inspection of oil and gas and monitoring of pollutants, is transferable and informs the climate work. The climate action team lead currently is in air quality, and they have a strong purchase on the climate work. Mental health impacts. Mental health has been a great presence within the climate action team, and we're just beginning to try to grapple with how mental health and communications interact to empower people and combat the sense of overwhelm that climate change and climate information can create. Transportation, that's kind of a homegrown topic. We have a lot of commuters. We have a lot of affected staff, or affected populations that we serve, for whom transportation is a major equity concern. And it's also happens to be the state's single greatest source of greenhouse gases by a hair. So it is crucial. And then lastly, but not least, mitigation through local and state policy. The public health has for a long time been involved in state policy on air pollution and greenhouse gases, as well as other topics. That work continues, and Boulder County Public Health's experience informs the work and the proposals that we've supported and put forward. So I think, the details of this document I have sent to you. You will see here in the right column, I've listed the leading programs within public health that lead each topic, together with leading collaborations, so that are outside public health and sometimes outside, as in regional or state. We do work with CDPHE on many of these. I would say that there are some regional networks that are still forming. There's an air monitoring and messaging network that is new, that is working towards summer ozone and air and smoke pollution messaging and monitoring is very applicable to climate. So all of these topics are a work in progress, but I'd like to stop now and just see what questions there are. I know that's a lot, and ultimately what we're seeking today is if there are any major questions, and hoping for approval to move forward. Thanks.
Yeah, let's see, we do have a hand up. Maury.
Hi. See if I can turn on my, hi. Thanks. Thank you, Colin and team, for all the work that went into putting this together, and thanks for your patience in bringing this to the board, because I know it's been a long time coming, and I'm really pleased to see equity as a key component and centered throughout the plan. And I guess I'm looking for some more information on how are you sort of partnering or reaching out with grassroots organizing groups or groups that are working with most impacted vulnerable communities to really deeply engage them early on in the process. I saw some references throughout the document that Joe had forwarded earlier too, but just would love to hear from you for a minute on that piece.
Yeah, thanks for that question. So there are a few prongs to that. Within the programs at Public Health, we have had members of the climate action team. We have members of the climate action team. Some may be present on the call today, who directly serve disproportionately impacted communities, and there is a level of representation that takes place there. I should say that the direct communication with community groups representing, I say disproportionately impacted communities like it just comes out of my mouth because that's the state statutory term for marginalized communities when it comes to climate, per House Bill 19-1261. But a lot of our capacity, I would say, over the last year to work directly with those groups has been tapped by COVID. However, I'd really like to recognize staff from Longmont, Francie Jaffe and Carmen Ramirez, and they have done a great job of providing very good input on what we need to do to best serve disproportionately impacted communities. I should also say this is one place where we lean on the state process a bit. I'm a member, Francie and Carmen are members, and we have an Oscar staff member who is a member. Oh, and Sheila Davis is a member of the Climate Equity Advisory Committee at the state, which is tackling these, or grappling with, I should say, these exact issues of how to provide direct representation in the community during a stressful time when people are very tapped and the channels are already occupied with, vaccination and testing. But I should say that I'm very optimistic that we will be able to mobilize better climate representation as coronavirus lets up a bit. And in the meantime, we're building those channels and identifying the right contacts, both at the state and the local level. I hope I answered your question.
You did. Thanks, Colin. And I guess I appreciate you continuing to kind of keep us in the loop, right, as how that work is unfolding. Because I think the opportunities also, as you said, in building those channels through COVID work and continuing those channels, and then also making the connection between the populations that have been disproportionately affected by COVID and the connection to climate change and the health risks they've already been exposed to systemically for years and years that have led to disproportionate outcomes in COVID too. So I look forward to hearing more as this work unfolds.
Thank you.
Yeah, and I should add to Colin that, obviously air quality and climate are near and dear to my heart. I commend all of your work, both you and Cindy and BCPH. You also really are the spearhead behind the Metro Directors for Public Health Climate Change Work Group. So, over the last few years, without you really kind of taking the reins and driving that ship, I don't think that group would be as far along. I know that a lot of these discussions around equity and climate are all things that we're grappling with. And yes, we have been slowed down over the past year, but I do think that folks have good ideas about how to better engage folks who have not been part of the process in the past or have not had the loudest voice in the room for that. So thank you for all of your work there.
Thanks, Greg. Really appreciate that. There were any other questions about the work plan or any I don't know, anything? I know it's been a while since we've come to you with this, so it may feel a little rusty.
I in some ways, I think the delay was perhaps not a bad thing. I mean, a lot of forces seem to be kind of all coming together at the important levels, right? Federal, state, and local. Obviously, the state's been doing a lot of really good work. The locals have been doing a lot of good work, and now it's nice to know that really to kind of take it to that next level. We also have support at the federal level, and hopefully that can be long lasting. So the time is right.
Yeah, that is how it feels to us. And this 2019, I didn't talk a lot about the policy, but you're probably all aware that 2019 set us up for a several year fiesta of rulemaking at the Air Quality Control Commission, the Public Utilities Commission, the Colorado Oil and Gas Conservation Commission, and others, and that we are up to our necks in that. So that's super rewarding, and boy, we have opportunities that we've just never had before. And it's actually part of my job and part of the job of the policy team to help raise the health and climate connection within that. And I think that we're pretty proud of what we've been doing in order to do that. We have a local government coalition that goes into those rulemakings, or I should say we co-lead that local government coalition, and we do emphasize health and public health and equity in everything that we do.
Well, thanks again, Colin. I'm not seeing any additional questions. Jeff, does the board need to take a formal action on this?
I would ask you to take a formal action and vote on this because we do want to make sure it's fully incorporated into the plan. And that was one thing that we were not able to do prior. And when you do that, I just do want to emphasize again how much I appreciate all of Colin's work. This has been her passion and dedication, and it's been really clear in the work that Colin has been doing, and all the folks, not just at the metro level, but Colin's been leading groups at the state level too, through CalFO, to really get support and organization around some key issues. So really appreciate everything that Colin's been doing to lead this. And as Colin mentioned, it's been with a lot of input from across our organization and others. So thank you again, Colin.
Thanks, Jeff. And I have to thank the members of the climate action team that have been hanging with us through thick and thin. They continue to show up and provide input and move these things forward in spite of the fact that, everyone is tapped for COVID in some way. So I'm just so grateful for everyone's input and everyone's support, and looking forward to the next couple of years of implementation.
Okay, well, can I hear a motion from the board?
This is Brooke, and I move to designate climate crisis as a Boulder County public health strategic priority.
This is Morgan, a second.
Okay, we have a first and a second. We've had our discussion. All in favor? Aye.
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 Okay, if I could vote twice, I would.
Thanks, Greg. Can I make a quick note for the record?
Absolutely.
Is there a chance that we could call it the climate action strategic priority, just due to the trying to keep it in line with the other two kind of action oriented rather than climate crisis? Just to keep it in line with all of our documentation says climate action.
I would be fine with that. Is there anything, do we need to re-amend and remove?
Trina, I don't know if you can advise on that.
I think that would be the best practice. Yes.
Okay, thanks.
Sorry to do that to
Sure.
you. I was talking, but I realized I muted myself.
So this is Brooke. I move then that we amend the designation of the climate crisis to the designation of the climate action as a Boulder County public health strategic priority.
This is Morgan. I second.
Okay, now let's vote again. All in favor? Aye?
Aye.
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 Okay. All right, well, thanks again, Colin. Really appreciate all your work.
Thanks,
Please-
everyone. Really.
And I know it's a team effort, so thank you to the whole climate action team.
Yep. Thank you to everyone.
Okay, all right, item 4, update on current COVID-19 pandemic.
Thanks, Greg. I'll take the lead to kick us off. So we have 3 items under here. The first one is approval of Public Health Order number 2021-2, which is amending Public Health Order number 2020-05, requiring facial coverings in public where social distancing cannot be maintained. And Trina is going to take the lead on this first one. We're doing some updates based on recent changes in guidance and in the state order. Trina?
Thanks. So Public Health Order 2020-05 is a public health order that this board passed in July of last year. If you'll recall, we implemented a local face covering order in May of last year, and then in July, the state issued a statewide face covering order to require face coverings in all public indoor spaces. We amended our order in July to effectively match the state order, but also require face coverings outside when social distancing cannot be maintained. Since that time, the state has made a couple more modifications to the state order itself. They're pretty minor, but we feel that it is appropriate to realign our local public health order with that state order. Specifically, there is an exemption for people who are actively swimming in pools to not have to wear a face covering, even if they're in a public pool. There are certain very limited exemptions for sports, and I will note that Boulder County Public Health has taken a position that is slightly more protective than the state's position on sports. For example, with wrestling, we have interpreted our public health order to require masks for wrestlers, whereas the state has not if you are participating in a CHASA sport. So this would just memorialize that formally rather than relying on the language itself only. And then the state has also implemented a 25-foot exemption for performers in certain situations and has since amended that exemption, and this would clarify that exemption. And then also along with this modification, we request that the executive director have the authority to make other such similar alignment modifications to adjust to changing state orders moving forward. And this order, like the previous order, would be good until rescinded. And I'm happy to answer any questions about this order modification. Otherwise, I'd ask the board to move for approval of it.
This is Morgan. Unless somebody had a question, I will move to approve Public Health Order number 2021-2, and then amending Public Health Order, which amends Public Health Order 2020-05, requiring facial coverings in public where social distancing cannot be maintained.
This is Jorge. I second.
Okay, motion and a second. All in favor? Aye.
Aye.
Okay, motion carries. Thank you, Trina.
Thank you.
Thanks, Greg. Our next item on the agenda is item B, and it's an update on COVID-19 vaccine distribution in Boulder County. And Chris Campbell is going to provide us the update on that. Chris, the floor is yours.
Thank you, Jeff. Good evening, board members. Let me get the presentation up here and we'll jump right into this. It's been a little while since we've seen you all, so lots and lots of movement on our on this unprecedented mass vaccination campaign. So great to connect with you all. Okay. And I'll go ahead and get started here. So Certainly, just to share for the board members, a lot of changes and movement in the statewide vaccine distribution plan, and we've made really, really good progress. I wanted to share with you in some of these areas, but yet a lot of work to be done still. So a lot of shifts since we met last, but we're moving through these phases diligently. Phase 1B one we'll share some data on, making almost 88% of our community members that are 70 plus have received at least one dose of vaccine. So feeling okay about that group. We'll talk about some of the areas we need to work on there and continue to work on. Phase 1B2 is yet another group that was open since we last met. 65 to 69-year-olds. We're making really good progress with that group. We'll talk a little bit more about what that looks like. Most of our even pre-K, K through 12 schools, moving through that vaccination process. Really want to thank the provider partners that have helped out with that. Early childhood education, likewise, the private schools in the community. Under that phase 1B2, we made really, really good progress on. Knowing there's still some work to be done, and we continue to work with providers to make sure that group is vaccinated. Just last Friday was some real big shifts to the phasing, mostly in recognition of a still pretty constrained vaccine supply. So this phase 1B3 was narrowed. So we have phase 1B3 and 1B4, although the group is really big. So these are about 60,000 community members that became eligible last Friday in this group. Community members that are 60 and older, frontline essential workers in grocery and agriculture, and then community members that have 2 or more of the high-risk conditions that are listed there. So again, we've worked with our provider network on that to ensure these folks, start to have access to vaccine. I'll take just a moment again to remind community members and board members here, we're still working through all the other phases as well. With a very constrained vaccine supply. We got, we've consistently still only gotten between 6,000 and 8,000 vaccines allocated to Boulder County. This past week, we did get about 11,000 vaccines allocated to the county, so that went up a bit, and that did include 2,000 doses of the new Johnson & Johnson vaccine. So the numbers are still just, not quite there, and I'll talk about what we anticipate that going up to in the early weeks of April. And then we know the new phase 1B4 we're looking towards, and that's likely towards the end of March. It's a big group. It's about 150,000, typo there, but 150,000 community members in Boulder County. And I won't go through that list now, just know that, and I'll talk through some of the strategies that we're moving towards with this new phasing. Just wanted to share our updated numbers with the board members. So great progress here since we last met. Then some areas I want to focus on, particularly is that that number of community members that have had just at least one dose of COVID vaccine. It's 66,000 community members in Boulder County. So we're making progress. And again, we know we have a long way to go. So it's about 20% of our population. With that first dose. And importantly, that the number with that full course of COVID vaccine is really moving up as well, about 38,000 community members. And we also wanted to discuss and show just the progress in the various age groups. We know that about 87, almost 88% of community members that are 70 plus have been vaccinated with that first dose, and that full course is really moving up, almost is about 66%. And we're making progress again in that 65 to 69-year-old group, which became eligible a few weeks ago. So about 66% of community members received at least one dose of vaccine. This data we will start to show some additional data. For example, here with the 70 plus community members, we want to show just relative to the metro area how Boulder County is doing, and we're doing pretty well. But the good news is even across the metro area, about 3 out of 4 70 plus community members have been vaccinated across the metro area. We are working on some additional data here. We'll be able to share next month, additional data by age group, so we can really start to parse that out. And I will share some data and this will lead into some of our strategies we're working on with our vaccination campaign. Just to remind board members, our overall strategy is really three-pronged. We've done incredible work, and I can't thank enough our provider network that we have worked with and created. So this includes all the hospitals in our community, the federally qualified health centers, Clinica and Salud, pharmacies in the community, CU Boulder, other clinics like Hope Light Clinic. And it's just been an incredible partnership, and we're really working hard as a group to provide access. So these are our traditional clinics. Just to talk a little bit about that capacity, that again, if all told, and that group really does ramp up to their full capacity, we could get up to about 25,000 vaccines being provided on a weekly basis. So that is, the structure that group is working within. We continue to explore that and ensure we're could even ramp up even more, and I'll talk a little bit about that. And then we talked about this a bit more, but we're really getting clarity on our equity strategies and making really good progress. And so we have a couple strategy areas here in terms of how the clinics will be structured, and then how we're going to ensure that community members that have barriers, known barriers, really struggling to access vaccine are able to access one of these clinics really easily. So we'll talk a little bit about these clinics, the mobile clinics, and some community clinics. The community clinics are these are going to be longer term clinics. They're going to be larger clinics that are run more often. And I'll talk about where those are and what that means, the progress we're making on those. Those really are focused on community members we know, have really have been challenged with equitable access to vaccine for a number of reasons, systemic reasons, and geographic reasons. So, we feel like we're making good progress in these areas, and I'm going to share some of that information.
Hey, Chris.
Yes.
So when it says less than 250 or greater than 250, is that like a daily capacity, or is that a weekly allotment?
So for the mobile clinics, that's just really the size. So those, just want to keep those smaller. What we've learned, those clinics will probably move around a little more often, based on locations that are identified by grassroots community input. So those will be smaller, just to keep them more manageable. And really what we've learned in holding a lot of these clinics, particularly as Boulder County Public Health, the smaller clinics are just a little less intimidating and feel, are a little more manageable. So those community clinics, they're going to be, that is a daily goal. It doesn't mean they're going to, likely some of those community clinics are going to run anywhere from 2 to 5 days a week right now, and they could scale up more than that.
Thank you.
You're welcome. And we do know that, that we are seeing disparities amongst community members being able to access vaccine. Latinx community members are definitely one that we know fewer vaccines have been administered to. So these strategies I'm discussing, that is really our focus area as a public health agency. As I mentioned, we have really focused, or we really feel good about that traditional vaccine clinic structure. And our focus really is truly this equity strategies and really implementing them well in a grassroots way. So our goals with these is really to eliminate these disparities with our equity strategies. One key component of that, and others can certainly speak to this if they're on the call, is addressing vaccine hesitancy. That really is a long-term focus. I'll talk a little bit more about that. We are leveraging trusted community partners. I'll talk about that. And this really is a shared leadership model we've employed. We have worked really hard to engage community members in various in various areas of the community to provide input, to provide thoughts on how to best to eliminate these disparities. Community ambassadors are a big role in that, and I'll talk a little bit more about what community ambassadors are. Yeah, Morgan, thank you.
All right, thanks. Can I ask a question? Do we know, I mean, are we collecting any data? What is leading our disparity in vaccination rates, especially with Latinx older adults? Is it primarily vaccine hesitancy, or is it primarily that they can't get access? Do we have a sense of what's leading that disparity?
I think that is a good question, dear. I don't know if you have thoughts there.
Well, Sheila might be on the call too, but we are concerned that it might be hesitancy, but we're also concerned about access to information, feeling safe about taking the vaccine, and also access to the vaccine. Sheila, I don't know if you're on the call, maybe you can share also.
Yeah, I mean, it's our strategies, our traditional strategies are rooted in the dominant culture. So I think it's really a combination of things. Access to rapidly changing COVID information that's translated into Spanish has been a challenge. Concerns about public charge has been an issue. Mistrust of public health. I mean, all of these things, I think, add up to why we're seeing the disparities. But, as Chris will share, we are addressing some of those by looking at the dynamic between government, BCPH, and our community partners.
Okay, thanks. I mean, I totally understand that they're both working against equitable distribution of the vaccine. And I guess I'm just wondering, are we at a place now where people who want the vaccine from Latinx communities have access to it, and we are trying to put more emphasis on addressing the information gap and hesitancy, or do we still feel like there's also an access gap there? I guess that's what I'm trying to understand a little bit more about.
Yeah, Morgan, I think that's a really good question. I think that's something that we'll have to dig deeper, and it's part of that community ambassador program to have conversations in order to explore and understand that. I will tell you that from a data perspective, that when you take the static poverty maps of Boulder County and you overlay them with the uptake of vaccine for 70 and older, that there are strong correlations there. And so, it's those social determinants of health. Many of those same barriers are in place. But teasing out which one exactly is driving it, it's hard to say. I think we would have to talk to our community ambassadors to help us tease that out.
Thank you.
Always great questions. We'll keep moving here, and this is a bit of a busy slide, but it does speak to, the structure we're working on creating and implementing as we speak. So, this really shows the flow of the work we're doing in this space. And we spoke a little bit about vaccine confidence and vaccine education. Sheila and Lisbeth Mendoza have been working on this. We're working on partnerships with Clinica to provide town halls to provide information on vaccine, the Beacon Clinic, and working with the LGBTQ community to do town halls with them as well. I know there's other partners out there that have done, CU has done town halls in this space, along with other partners we know at the hospitals. So this is a big focus to ensure that folks have information in the community. Should they choose to get vaccinated, they have the information they need to make that good decision. So we're doing a lot of work in that role. We're resourcing it. Our goal is to continue to do town halls, and I'll talk a little more about that. Additionally, we have created a VEC committee, which is a vaccine equity coordinating committee. The goals here are they're really informing. It's a grassroots group, really informing, community vaccination sites, working and identifying community members and trusted representatives to inform our plannings. This is a group that really is informing this really community-driven process. So we have partners, community ambassador partners like Amistad, now Boulder, and Acambio. NAACP is potentially joining those. El Comité, our peak-to-peak partners, the Peak-to-Peak Housing and Human Service Alliance, will join this committee, and they're going to form what's called a community of practice where they meet regularly. We're measuring the impact of this strategy, ensuring that we have the right locations and sites, and also meeting our goals here. And then really the bulk of the work is going to be connecting community members with that vaccine connection. So we're working through the ability to, on the ground, help folks get registered, do that pre-registration, identify community members, and work with them to get signed up for a clinic. So this could be any one of our clinics with the vaccine distribution. It could be those smaller mobile clinics, the longer term community clinics, or even the traditional vaccine avenues. So this group is key. Lisbeth Mendoza will be working with that group along with Sheila Davis. Community ambassadors play a big role there that I mentioned. I do want to mention also community influencers. This group really is going to help us connect with community members and really get the information they need from an education perspective, and then ultimately get signed up for clinics. So, these include the chambers of commerce, Latino chambers of commerce, the school districts, Boulder Community Connectors, the Family Resource Centers, so our center, EFA, Sister Carmen. You see this is a diverse and vast group that really is going to help us identify community members, get them the information they need, and really help them get signed up for vaccine clinics. We talked quite a bit about this. The vaccine hasn't seen that vaccine education, so we really are starting there and continue to do those. I'll move through these pretty quickly. So Sheila has done an estimate about 10 of these town halls, along with Lisbeth. Dr. Urbina has done some of these town halls. Again, the goals of these town halls are to address those issues or vaccine concern within our priority populations, receive feedback about the rollout, how it's gone thus far, and also get information about our equity approaches. So our audiences have been faith-based groups, community-based organizations, the pre-K through 12 community, and great town hall with them, community foundations, the Boulder County Community Task Force, cultural brokers, Colorado Department of Public Health and Environment. Their community advisory groups likewise have been audiences of these town halls and informed all these strategies. Sheila has worked really hard and collaborated with the American Public Health Association and the American Medical Association on these town halls. So I want to get a little bit weedy here, but just really give the board a good sense of what we're working on to implement and plan for in the next couple weeks. So I did mention the community clinics. We're working to identify a Longmont site, and the exciting thing about this is going to be a partnership with Salud Family Health. Salud has been identified as a national federally qualified health center to provide a vaccine and get an additional vaccine allocation to support equity strategies. So we are working with them to find a site in a great location, an accessible location for community members. That is going to happen within the next 2 weeks. We're excited about that. We also have a great partnership and are excited for a long-term clinic at our Southeast Community Hub location in Lafayette. This is right next door to Clinica. So this is going to be a partnership with SCL Health, Clinica Family Health, and Boulder County Public Health. Again, this is a clinic that SCL approached us about running. Their mission with this clinic was to really focus on priority populations and the equity strategies we're looking to implement. And Clinic is really going to help us out with their knowledge working with priority populations. So we're really excited about this. The agreements are almost complete, and in the next week or so, we hope to have that operational. Anywhere from, we'll be holding clinics there anywhere, starting at about 3 days a week, I believe. It could scale up to 5 days a week. So we're very excited about that. So as those sites continue to be identified and finalized, we'll continue to work through the process of ensuring community members access these long-term sites. So working with our community ambassadors in the work I just talked about, they're going to play a crucial role in and also get paid with some budget or also get some funding to do the work on this. So we're working through a scope of work with them. Again, this is community driven, where we are ensuring that we're meeting the needs of the community and providing it the right way. So these clinics will make sure they're operational, have all the resources they need. For the equity strategy on mobile clinics, I did want to mention this is one we've already moved forward on and really wanted to pilot and understand. So we had really strong help from Bloom Health as a provider. Also King Soopers and Safeway Pharmacies helped out with these clinics. So we've done about 40 clinics and affordable independent living sites in the county, and this has really met our equity goals here. These are folks living in independent living sites with the Boulder Housing Partners and Boulder County Housing Authority and Longmont Housing Authority. We've been able to administer 650 vaccines with this group. Now we're just about finished with those sites, shifting the focus of these mobile clinics to some identified homebound individuals in the community. So ensuring we provide access there, determining if there's any remaining eligibility within these sites as we've moved through the phasing that has changed as we've implemented these. And then ultimately, as I talked about, these clinics are going to move towards other sites throughout the county, and we're establishing criteria about which sites we choose. This is being driven by the very flow that I presented earlier. With community members really driving that, the community ambassadors really informing those decisions. So we're working through that in the next couple of weeks. We did get feedback from the community that school sites are very trusted, and so we are finalizing plans to do 2 school-based clinics, one likely in Longmont and one in the city of Boulder in the next couple of weeks, likely kicking those off towards the end of the week of March 15th. And then our existing provider network, I just want to remind board members, so we meet on a weekly basis with that group. We talk about vaccine allocation. We talk about barriers they're seeing. It's, again, a really good approach we've had, and I think that's why I've had such success thus far. I did mention, and everything we're hearing is we will see a significant need to scale for additional vaccine in early April and beyond. And, so we should hopefully see a larger vaccine allocation to Boulder County. We're planning towards anywhere between having the capacity to do, about 35,000 vaccines on a weekly basis through that group. So we're ensuring that that group is ready to go, that they have staffing in place, that they're committed to supporting that strategy, and it's that's working well, and we're working through that in the next couple of weeks. Within that group, we're just making sure that the hospital systems in the county are getting additional vaccine allocation, and they're committed and continue to be committed to working with us. We just also to mention, we have been working with the agency administrator group in Boulder County. These are all the municipal leaders in the county. They'd really like us to explore the vaccine finder type tools for Boulder County. So we got direction from them. We're working with both Boulder County IT and City of Boulder IT to look at these types of tools. Just to mention to the board, these tools are challenging. They could actually cause more frustration for community members. The CDC is recommending a vaccine finding tool, and also the governor's office. The challenge with those right now is they're an incomplete data set. So some just show pharmacy partners, for example. So we want to explore those tools, assess those, and then work towards buy-in from our traditional provider network. So that's happening in the next couple of weeks. I will mention that the Mobility for All team with Boulder County has a transportation plan we worked through. And we're excited about that. That's finalized. It's going to be up on Boulder County's Public Health website and is going to be widely distributed to partners. And this talks about all the transportation options to get to vaccine clinics. So we're excited about that work. And we're really trying to bolster and work towards a really robust public information campaign. And we do need, and we're looking towards a more formal structure for that through a joint information system. So we're working through the mission of that and the structure and how often they're going to meet. And so what this group will do is it's a wide group of communications folks and public information officers from throughout the county that are really going to help us get the word out to community members. And we're excited about that, moving that direction. Boulder County Public Health will ultimately provide the bulk of the information for that group, and they're really going to help us get the information out. So we'll continue to develop the vaccine education campaign we discussed, and many of the community forums we're doing. We do a bi-weekly Wednesday community forum for community members. We'll continue that as well.
Hey, Chris. It's Morgan again.
Go ahead, please.
I have another question about, so I'm so pleased to really see the county deeply engaging these ambassadors, organizations that are deeply rooted in the community. I think that's great. And thank you for going through all of this. One question I have is the role of ambassadors, or if there's, when you have, I know I've seen on the county website, I want to sign up for a vaccine, but I have a hard time with doing it via the internet, and you can phone call this number. Is there actually somebody who will then walk through and sign you up for all the various lists of vaccines and kind of walk you through that versus just pointing you towards where you can get vaccines and information?
Morgan, is a great question. There is, and with the Boulder County Public Health Call Center, the answer is yes. What we do know is we need to bolster that. There's a couple areas we're working on. That is a partnership with 211 to do that, to help us out with that work, and we've been exploring that and have implemented that. We know we might have to scale it a little bit, particularly as we move through that 1B4 group. It's such a large group. The call center has that capacity currently. We just want to make sure that it's scalable.
Super. Thank you.
This is Brooke. Can I jump in and ask a quick question as well? So since we are getting so few doses, only 6,000 to 8,000 a week, do we have a specific county plan that's a directive for all of these sites to ensure that we're not wasting any doses?
Yeah.
Do we have specific call lists or anything to make sure nothing's getting thrown away?
Absolutely. And it's a great question. And, this has been, from the very start, we've been clear with our provider group that we don't throw out vaccine. So the group has, we've left it to them to determine their internal approaches. What we do know is basically our providers, in essence, have backup list for folks that fall within the phasing. So folks can sign up for those lists through those providers. There's different ways they can sign up through them. It's mostly, they mostly have to call those providers, is my understanding. And what they do then is they just go through the process of calling them, folks that are on the backup list. So folks provide phone numbers or contact information, and the group moves through that. To my understanding and knowledge of working with this group, I think the group has been remarkable at vaccine management, and there's no vaccine being wasted.
Thank you. And are we tracking that? Like, are we noting how many we're providing to each provider?
I mean, so anecdotally, I can say, because we've done so many clinics at Boulder County Public Health, you usually have at most, like 10 doses left over at the end of the day, or it's a really small number, right? Is that the question you're asking?
Yeah, I'm just curious if we're accounting for it. So we're saying, you received 250 doses today. We're all 250 administered. How many, just to ensure that none of them are getting wasted with such a small number.
Actually, the state is watching for wasted doses. So they're monitoring if anybody, because you have to record if you waste a dose.
Got it. Okay.
It's a big no-no.
Yeah.
So the goal is you get it into someone else's arm. And if you have to go beyond the phased distribution, you go beyond the phased distribution, because it's all about not wasting any doses.
Yeah, I will say this is one good area that the state was pretty proactive on. They made pretty clear with us. And again, it's amazing to look back at how far we've come with learning about these vaccines. The message from the state was always, do not waste vaccine, do not waste vaccine. If you have to go outside the phasing, go outside the phasing. And I think so that, we really created good systems with our partners to ensure that doesn't happen.
Thank you.
Okay. So I'm done. I appreciate. I knew this update was going to take a while. And honestly, this is really scratching the surface. There's a lot of things we're working on right now, but I do want to recognize just the incredible work of our group and everything they've done. I just got to mention, this really is an unprecedented mass vaccination campaign. Our team has really jumped in and been remarkable. And we're going to continue to work hard for the community. There's nothing more than we want to do than to vaccinate every Boulder County community member, and we're going to continue to work towards that. So information here, just I want to share with you all. Again, this has the call center number on there. If we, certainly can get just regular information at our websites in English and Spanish. And the eligibility and locations for sites to get vaccinated or how to sign up is also on our website. So I want to share that with the board and community members. And we'd be happy to answer any additional questions.
Thank you for that update, Chris. As supply continues to increase, any planning for what you would call a mass vaccination site in Boulder County?
Yeah, great. It's a great question. So, the Boulder County Fairgrounds is one we know could scale if needed. Additionally, that the clinic that I mentioned, the Southeast Community Hub, has the capacity to do, about 1,000 vaccines a day, and they could even scale up to 5 to 6 days a week. We're ensuring that we can meet those needs. I mean, for me, that a mass vaccination clinic is a little misleading. I think as long as we have the capacity and it's very well dispersed and to meet the need, that is our number one focus. I would say that we do know that the state is going to have some larger scale mass vaccination clinics that is going to be a resource to us, and they're gonna use their resources and FEMA resources on that'll be mostly in the Denver metro area and also in Larimer County. There's 5 sites they're looking at across the state, and one including on the western slope. Our goal as a team and in the Boulder County community is to make sure that we have a very wide geographic area covered. and we're meeting the needs of the community. So, I mean, even for example, and I can't say enough about the work that Boulder Community Health has been doing. I mean, they're regularly doing between 800 and 1,000 vaccines a day out of their clinic at Boulder Community Health, which is amazing. And so we're basically, in essence, doing mass vaccination clinics throughout the county as we speak. So I feel pretty confident in the structure we have built. We do have some contingency plans in place we're looking towards, particularly as the weather gets better, for drive-up clinics or drive-up vaccination clinics should we need to get even more vaccine out. So that is a part of our strategy, is a kind of a backup plan.
Great. Good to hear. Thank you very much.
You're welcome.
In the interest of time, folks, I think we will move on to Jeff's update. Not to give you the bombs rush there, Chris, but.
No, it's okay.
Hey,
a lot of information to share.
Thank you.
Thanks, Greg. And mine is going to be short. I do want to say how much I appreciate our team. I have heard from SCL, from Centura, and from Clinica as recently as today, and they work with people in all the counties around us, and they have consistently said how far advanced our team is, how much we've planned ahead, and I think it's demonstrated in that data that Chris showed, as well as some other data that you haven't even been showed slides on yet. But we are doing an incredible job under very complex situations, and I want to thank our team and our providers, any of who might hear this, because it's because of them that we are doing so well. So thanks to everybody who's doing work on this. I'm going to share my screen, and we are doing well in terms of data. Too many slides open, bear with me. Well, hold on, I have to back out. This happens every once in a while, and close some windows and go from there. So hold on a second. Okay, let's try this again. Huh, so interesting that I cannot see my slide deck, and I don't know why. Hey, Chris, can I send this to you and have you display this for me? Because I can't even see my slide deck, which is really strange.
Yeah, go ahead, Jeff. Shoot it over. I can get it up here.
Thank you. I appreciate that. Bear with me one second. All right, it's on its way right now. Oh, I got it. Here it comes. I just closed it out. I'm gonna try to open it one more as it's going over to you, just to make sure it doesn't pop back up. It did pop back up. All right, let's try this again. Nope, it's gone now. I have to wait for you, Chris, sorry. And well, Chris, thank you so much. You can jump right into the next slide. I'm going to go through these fairly quickly, but the theme here is going to be that we are seeing decreasing and stabilized numbers, not just locally, but also in the state. The one thing that we are watching in the state is variance. So we have heard that there's been more variance reported in the state, and we're going to keep an eye on that, because how quickly variants we find them in the state is going to make a difference on how much transmission control we have to control our numbers. But you've already heard that in general, we're doing great in terms of our vaccinations. And that's both in our 65 to 69 age group as well as 70 plus. But you can see here that our metro numbers are declining, some uptick and then some downtick, but it's pretty stable at this point. Next slide, Chris. This is the state numbers. You can see again here we're on a decline, but it's a slowing decline. And this is what we've heard the state say as well. We'd like to see a more rapid decline, but we still are on a decline. The more vaccinations that get out, the better we're going to see a decline. And one of the key messages that you're just going to keep hearing me say and say and say is that we can't give up on masking. We can't give up on social distancing, the things that we know will prevent the spread of the disease until vaccines are distributed more widely. Next slide. We are in yellow on the dial. We were at 6 days in blue for 2 of our 3 indicators for a while, but we've been bouncing back and forth right over the blue and yellow line. So we probably are not going to be moving to blue anytime soon, especially considering that we'll have kids come back from spring break in our K through 12, and they will be closer to full time. And we now have the University of Colorado students here in person as well as a hybrid model. And we saw, everybody probably saw what happened over the weekend. We do expect some cases associated with that to increase. We do, however, expect that because we vaccinated most of our high-risk population with at least 1 dose, and we're doing well in terms of second doses, at least for the 70 plus, that we will see less hospitalizations and less deaths, which is of course a good thing. Next slide, please. This just shows that we're on a declining trend. This is our 7-day average, 40 at 45 point. Can't quite read it. I think it's 6 or 8. Next slide, Chris. This is our numbers of cases, and the blue cases on the top are CU cases. They are fluctuating up and down since kids had come back. Some moved in earlier than February 15th. The off-campus students, on-campus students were around February 15th. And when we looked at the cases last week, about 35% of our 18 to 22-year-olds were CU cases. So we know less than half are CU cases at this point, but we are keeping track of our individual age groups and continuing to look at CU specific cases as well, and we'll continue to do that. Next slide. This is our hospitalizations. We were at 11 as of today. Our hospitalizations have come down and have continued to stay low, so we do think that will continue. And again, a bit of that is going to depend on how well people do as vaccine continues to get out. Again, still need people to mask, still need people to social distance and not get into large groups where they're not masking. Next slide, please. This is our deaths. Our deaths have come down pretty consistently. I think the next slide shows specifically the impact we've had on long-term care. Chris, can you advance it? Yep. The orange bar on the top of that is just a testament to getting vaccine into those facilities. We can see how much of a difference that made. That's consistent with state numbers that we've seen as well, and metro numbers. Next slide. And this is the last slide. Just we are at 100 or 1 in 194 people in Colorado that are infectious. That was from a couple weeks ago. That will likely be updated again this week. We were doing better the last time I reported this. I think we were at 1 in 238 at that point. So the social distancing has dropped a little bit between then and this report. If we were at 83% and we are closer now to 76%. So again, the main message to people is, don't give up. We have light at the end of the tunnel here. We're getting vaccines out. We just need people to hang with us for a couple more months. We are hearing from the state that we're going to receive more vaccines by the end of the month. And I think they're pretty confident in it because they're saying it quite a bit now. And as the vaccine gets out, the risk is going to continue to drop. We definitely do need people to get vaccinated when they have the opportunity to do that. A month from now, it's going to be a lot less of worrying about when can I get vaccinated than it is right now. So we need people to just hang in there with us for a couple more months here. And we want to make sure that people get tested too. We don't want to give up on testing. It's really important because we know that roughly 50% of the people that have this disease don't even know that they have it. So it's really important from two perspectives. We want people to get tested to know if they have the virus, and we also want people to get tested because the state is running a certain number of samples to see if variants are present. The testing is free. The state's committed to continuing the testing as we move forward. So please do take advantage of testing if we've got public listening to this presentation. And I'll stop there and see if there's any questions.
I am not seeing any questions, Jeff.
All right.
Okay, well, thanks for the update. And yes, continue to be diligent. I know we're hearing news stories over the last week of folks, states relaxing any and all restrictions, it seems like. And so hopefully we don't get any of that coming into Colorado during spring break.
Sorry, Greg, one quick question for you, Jeff, because I don't think it was in the data you just went through. How are we doing in terms of disparity of cases affecting Latinx community members?
In Boulder County, we're actually doing a little bit better based on the data I just saw presented from the state. And when I say a little bit better, it's relative to Black, Indigenous, and people of color. We are at about 88% of 65 plus, which is not leading the state, but it's in the top quartile of the state in terms of how well we're doing. If you look at, and I can actually share this slide, I think I have it right here.
Not in terms of vaccinations, but in terms of actual cases of COVID that we're still getting through testing. So
yeah, maybe Sheila or Indira could talk about that. I'd have to look at the data slide to see that.
Yeah, Morgan, I think that we're making some improvements, but the relative risk analysis that Emily Payne runs, which kind of shows that measure of association where they compare kind of the Latinx community against white non-Hispanics, does still show that there's increased risk for cases, but I believe the hospitalizations and the deaths have both gone down and are actually lower than what you see with white non-Hispanics. So you kind of see these big curve, from last spring and summer, and then it looks like some of the resource navigation, some of the efforts that we're doing on the prevention side seem to be helping. But I don't think they're completely gone away in terms of the cases. It's just that the impacts for hospitalization and deaths look like they're going down.
Great, thank you.
Okay, well, thank you everyone for that very information-packed update. And now we can move on to, do we really need to do item 5? Retirement and transition for public health director. Susan, are you kicking us off on this one?
I will definitely kick us off.
Okay.
I think that I'm Susan Motika, Strategic Initiatives Director. I think what we heard tonight, this kind of updates in past board meetings is really a testament to Jeff's leadership, to him being a catalyst for the leadership of his staff to do policy, to do systems change, to do some of the most innovative programming work in public health in the state, and that he fully supports us in this. And the Metro Denver Partnership for Health, I wouldn't go into all of Jeff's accomplishments, and I know other board members have remarks to provide. But this is a group of the metro area directors who I just want you all to know consistently look to Jeff for guidance, for leadership, and they look to his staff and say, well, can so-and-so do that? Well, can so-and-so call me? What about that initiative you all are doing? So it is really a testament to the kind of innovative, quick thinking that Jeff has been known for since the days, and the Board of Health remarks background briefing indicates that he started in mosquito control in the summer of 1989, has come to a place of incredible system and policy achievement and tremendous support for staff and community and partners. So, Greg, should we turn to the board members? And I also want to acknowledge to the staff and many others who are on the call right now, there will be a more informal event happening for Jeff as well, but we wanted to make sure to take this opportunity to have the Board of Health be able to acknowledge and recognize Jeff. We have a tribute to him as well. So Greg, would you like Jeff to show what he got delivered today? Or should we go to remarks? It's, you know, at your pleasure. What do you think makes sense?
Jeff, why don't we have that introduction first, and then the board can some
Greg,
words.
you're echoing a little bit. You're echoing back and forth a bit.
Okay, I'll turn off my video. Hopefully that helps. So yeah, Jeff, if you want to talk about what you received, and then the board members will take it from there.
So I received this very nice box in the mail today from Rita, who delivered it personally to my house. I was instructed not to peek in here, so I have not done that. So I'm going to open the box now. Oh my gosh. Wow. Oh, wow. Wow, this is fantastic. For the courageous and visionary leadership as BCPH's Executive Director, 2008 to 2021, with a public health emblem on the top. That's incredible. Can everybody see that?
Hold it a little higher, Jeff.
Just incredible. That's amazing.
Well served, Jeff. Yay!
That is absolutely amazing. Thank you all so much.
We were looking for that kind of flat iron approach in the background.
I love it. That's incredible. Thank you so much.
Yeah, that's very cool. All right. Well, as president, I will go first. So I started with the Board of Health about 9 years ago. I think it was this month, actually. And, you know, as someone who's worked in a bifurcated health department in Denver, Jeff and the awesome team at BCPH helped me to realize the many advantages of having all of these different public health disciplines in a single department. There's a long backstory there, but it's really important. It's been important to me, and it's been very insightful to me as I've been able to offer my input into how we will look in the future. I'm grateful to have learned many new things about public health from Jeff and the staff, from mental and behavioral health to family services, addiction and recovery to healthy kids in schools and their never-ending challenges, and even in new areas of environmental health for me, like body art and on-site wastewater treatment. Oh, and there was also that COVID thing. So my introduction to the board was through a long-time working relationship with one of BCPH's former staff, Pam Milmo. We led our respective air quality programs, and we really kind of came to this idea of banding our resources together and leverage our resources. And you know, we didn't have teams of lawyers, and we didn't have consultants that we could bring in for expertise. But that partnership started, and it grew stronger, and it really gained a lot more traction with the next generation of staffers. So Colin, who you heard from earlier, Cindy Copeland, Bill Hayes, and Joe Malinowski, who led that team. So good ideas spring from good leadership. So Jeff, you are a big part of that success. In my 9 years, I've learned so much from this great crew, and I can honestly say that Jeff is a model for how to balance vision, mission, staff engagement and development, all while remaining as cool as a cucumber. So this recognition is well deserved, though in his usual way, Jeff is always the first to acknowledge that any accolades that might be bestowed on him are really, honored as a result of all of the hard work done by staff, the management team, and the director team. So we will miss your leadership, Jeff, but you've set a really high bar that provides an exciting opportunity for the next director to tackle the real challenges facing our society as life gets back to normal. So I look forward to working with all of you to select the next director and achieve the bold vision of the strategic plan crafted over these past several years. I wish you a happy, healthy, and prosperous retirement, Jeff. Thank you for all that you have done.
Thank you, Greg.
Well, if I might, I just want to say thank you, Jeff, for all your dedication and all your hard work during these whole years that I have been part of the board member. I have seen your leadership and your example as a director. Believe it or not, when I first met with you, to become a board member, I don't even remember when was that. Long time ago. The first thing I want to tell you, I feel jealous because you are able to retire pretty young age. Let me tell you, congratulations, and enjoy the rest of any adventures you might have. But in terms of your leadership at public health, I have seen you really going through different transition process within the same organization. And it's something that I really admire from you was you are so easy to talk, and you really listen to the message that anybody can actually share with you, and know everything that you really share with the board members, and everything that I share with you, anything through the board meetings that we had. Listening to a lot of people on their staff under you is very difficult. And I admire that, how you have take, Boulder County Public Health to the next level as an example across the state, because we work with other counties as well. And it's true. Every single time that I talk to other organizations across the state and other counties, they would say, oh my God, but what you guys do at Public Health in Boulder County is incredible. So I thank you for your leadership and how you have taken, public health to the next level. Yes, as Greg mentioned, we will miss you here. We will miss your leadership. And this is an opportunity for whoever is coming to take that level that you left the organization even higher. Congratulations, Jeff.
Thank you so much, Jorge.
And if I could just jump into real fast, Jeff, and say thank you so much for all that you've done, this last year, which is quite a year to go out on, and all of your tireless time and energy put into all of the public meetings and all of the work that has gone on in the last year. So thank you for that. And then for the 30 years prior to that you were supporting our community through your work at Public Health. And I am especially appreciative of the courage and leadership to really take on health equity out early on in a way that I think a lot of other public health departments around the country still have not taken on. And really, I think public health has been a leader throughout Boulder County government in so many ways and in centering health equity. So it is hard work. And there are a lot of bumps along the way, but I am so appreciative of your tenure being the time that public health really dove into this and we will continue to do the hard work going forward. And we will miss you, Jeff. We'll miss your upbeat personality and your willingness to reach out and connect to community partners in such an authentic way is going to be missed too. So we have big shoes to fill, and thank you so much for all of that you've done for our community in all these years. And we hope that you won't be a stranger too.
Thank you so much, Morgan. I won't.
I was going to jump in and echo all those sentiments. Thank you for welcoming me to the board kind of right before everything started. And I'm glad that we got to meet in person before it all went down. But thank you for all of your contributions to everything. It's been great working with you.
Thanks, Landry.
And I'm sad I never got to meet you in person.
I know.
I guess that'll be my big regret from my term here on the board. But thank you so much. Just to echo what everybody else said, you've been an inspiration during COVID and handling this pandemic in a very calm and cool way, and listening to a lot of different opinions from a lot of different places and valuing and absorbing all of it. So thank you.
Thank you so much, Brooke. Is it okay if I comment a couple things just about the board? I have to tell you that, so I work with directors from across the entire state, and the Board of Health that we have here is incredibly supportive. You're going to have somebody who comes in here and does a great job because of all of you. You're extremely supportive in the types of policies that need to get advanced in our county and in our state, and your support to do all this does not exist everywhere. It does not happen. You've been an incredible board to work with. I have told so many people so many times, even in presentations, how lucky I am to have had such a supportive board for all the years that I've been here. So thanks to all of you. Please keep that up with the next public health director. It's going to allow them to take the vision to the next level for sure. So thank you.
And well, thank you. Thanks again, Jeff. I mean, it's been an amazing run, and the county is definitely better off under your leadership. Jeff or Tammy, item 5B, update on the recruitment. Who's anybody providing that?
Tammy's
Yeah,
got the lead, I think.
So, as you all know, the state statutes require that the Board of Health be appointed by, that the Public Health Director be appointed by the Board of Health. And so you are working with a recruiting firm and the county administrator and I to move that process forward. Human Resources, Millie Dawson, has been working with the recruiting firm to ensure that the county's equitable hiring practices and principles are in place for this recruitment. So she's been working really hard on that. The things that we need to ask of you tonight are to appoint Lexi Nolan, who is our Deputy Public Health Director, as the interim Public Health Director until the new one is on board. Jeff, I think, is going to share some information on Lexi. And then we will need a motion to adjourn following this meeting to meet in executive session to go over some things with the recruiting firm. You're muted.
Yep. Thank you, Tammy, so much.
Sure.
Yeah, what I want to do is just, and you all have Lexi's CV. I know you haven't had a ton of time to interact with Lexi, but I want to let you know, and I'm going to have Lexi talk a little bit more about herself and her background, but I want just to let you know what I've seen. She's been here for a little more than 6 months, I believe now. What an incredible asset she is. She has brought to this organization, and Susan can attest to how difficult it is to come into an organization with such complexity. We have so many partnerships. We have so many areas that we're doing work. It takes a long time to get grounded in this organization. There's a lot of complex moving parts. We have lots of different budget pieces coming from lots of different places. And it's the reason that we're so successful in Boulder County Public Health, but it also makes it really difficult for somebody new walking in to be able to ground themselves and all that. And Lexi has done an incredible job. Lexi really spent the first, obviously this was not a normal process of orientation. Lexi was really thrown right into it from the first week that she was here, but she's done an incredible job just grounding herself with all of our staff in each of our divisions, making sure that the leadership teams know her, that she's hearing from them, making changes and supporting them. And I've heard great and incredible feedback, especially from our division managers around the work that she's been able to do. She's also already developed strong partnerships with the University of Colorado. She's worked with our agency administrators. Those are all of our municipal folks and is meeting on a regular basis with City of Boulder and City of Longmont, two of our major folks who are very involved, as you know, in the COVID work that we're doing, and incredibly critical partners as well. So she's already developing all of those relationships. She's been in meetings with me, with both of the superintendents, so that there's a positive transition from that aspect. She's been meeting with me on the state calls, so she knows the situational awareness of where we are and how things are moving forward. And I think, as you all know, Lexi worked to develop our own Boulder County Public Health COVID-19 plan right after she got here, because she could see the necessity of having something that really laid out a clear path for us. Then, in addition to that, she worked in close partnership with the county to make that a Boulder County, or not, Boulder County COVID plan. So the work that she's been doing has just been incredible. I fully trust Lexi to move forward in this interim role. I know she's going to do a great job. She is not applying for the position of executive director, so there's no conflict of interest to make sure that she gets wrapped into and supported in that process as well, to help support bringing in the new executive director. I just want you to know that I fully trust and support her, and strongly making the recommendation that you appoint her as interim moving forward. And I'm going to stop there and just see if Lexi wants to add a few things about her background, and then if you have any questions for Lexi or I.
Thanks, Jeff. Well, I guess I'll just say, if you've seen my resume, I don't want to go through the litany of where I've been, but to just make a statement to you guys that I have a really deep commitment to equity, to recognizing how we are strong as an agency when we work collaboratively with our partners across the county and within the community. That I believe in systems design as solutions for problems, partnered with strong engagement, and that my experience so far at BCPH has really just been that it is an amazing staff of folks who have an incredible handle on their work and what they know needs to happen, and that I appreciate Jeff's generous words, but a lot of my work has really just been finding the spaces where just a little bit of support and a little bit of tweaking can really help us move quickly, and in spaces that really make a strong community impact. So I very much appreciate the endorsement, and I look forward to bringing more of my background and skills to Boulder County Public Health.
Jeff, Jana is also on the meeting if you want her to say a few words or not.
Jana, you're welcome to jump in. You've been leading the charge on the new director, which I greatly appreciate. I think all the Board of Health members know this, but Jana is a partner from the county with us and has been taking a major role in a lot of this. Really appreciate her leadership and partnership in this as well. Jana, do you have anything you want to add?
I'll just very briefly say that, you know, I realize appointing an interim director is probably not what the Board of Health wanted to be doing right now. You probably wanted to be appointing a director to, you know, succeed Jeff right away. I have full confidence in Lexi's abilities. She's been a tremendous addition to the public health executive team. I've gotten the chance to work with her pretty closely on this pro boco COVID response structure that we have established. And, you know, just here to say that the county is happy to support this transition in whatever way we can to make it as smooth as possible for the board and the staff and the community.
Greg, the only other thing I would add that I didn't say is I have offered, I know to you directly, but also to the director's team, that I could be here to continue to support the transition until the new director's here. So I don't want you to think that I'm just jumping ship and leaving. I'm happy to help in the interim as well.
No, I'm glad to hear that, and yeah, I support that, and it's, you know, I would say that's a fairly common model, especially when you're having a change that, you've been in place for a long time. And so I think it's really important. And so thank you for being willing to do that. Any questions or comments from the board? We will need to approve the appointment of Lexi as the interim executive director. Okay, I'm not seeing or hearing any comment. So can I hear a motion, please?
This is Morgan. I move to appoint Deputy Public Health Director Lexi Nolan as Boulder County Public Health Interim Public Health Director. Congratulations, Lexi.
This is Brooke, I second.
Okay, we have a motion and a second. All in favor? Aye.
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 Okay, thank you very much. Congratulations, Lexi. Yeah, April 1st, we'll be here before we know it, right?
Indeed.
So now we need the motion for the executive session. Or the executive sessions. We need one scheduled for immediately following tonight's meeting, and then we need another one for 5 p.m. on March 17th.
This is Brooke. So do I move to adjourn first?
No, we need,
No,
you
just
can go ahead and
move.
just say that we're going to move into executive session following tonight's meeting, immediately following tonight's meeting, and then we need another motion for 5 p.m. on March 17th. And then we can finish the rest of the meeting.
So
Got
two
it.
motions, Tammy, what you're saying. Okay.
And we do need to cite the reason for the executive session. I believe it's personnel
Yes.
matter. Do you have the statutory cite, Tammy?
Yeah, it's on the agenda. So if you can
Perfect.
just say adjournment into executive session. Well, when they adjourn at the end of the meeting, they can say that they're adjourning into executive session at that point, and quote the Colorado Revised Statute section number, which is on the agenda.
So basically item 5D for the board members, that's what we are getting. And then we'll do subpart A, subpart B. So
Yeah.
two motions or 5D. Okay.
Okay, this is Brooke, and I can move for the first motion. So I move that we will adjourn to the executive session pursuant to Colorado Revised Statutes 24-6-402 4F for the purposes of discussing the public health director recruitment process immediately following this meeting.
This is Jorge, I second.
Okay, so we have a motion and a second for 5DA. All in favor? Aye.
Aye.
And then Brooke, can you do
Yeah.
5DB?
Yep, sure. And then I move that we will convene for the executive session pursuant to Colorado Revised Statutes 24-6-402 4F at 5 p.m. on March 17th, 2021 for the purposes of discussing the public health director recruitment process.
This is Morgan. I second.
Okay, all in favor? Aye.
Aye.
Okay, thank you very much. Long agenda. If the board is okay with it, we'll skip the director's report and hold the new business. If there's a burning question, we can go ahead and get that out there, but if not.
Can I do an announcement real quick, Greg?
Sure.
All right, am I okay to go?
Yes, go ahead, Jeff.
So I do want to make an announcement that is an important announcement. So tonight I will send out the letter that goes to our staff that announces Lexi Nolan as our interim. In addition, in that announcement, we are going to be letting staff know that Susan Motika is also going to retire as well. Susan, I don't know how many folks on here know this, but Susan is going to retire. She is actually pursuing a play and is deep into it. And she's been very kind and willing to both hold off until we were a little further down the road. So I just want to make sure that we have time to recognize Susan. I'm hoping we can do that on the front end of the March 15th meeting so that Susan has the recognition that she deserves in before she departs the organization. Her last day will be April 7th. And she's
9th.
Oh, sorry. Thank you, Susan. April 9th. And I want to make sure that Susan, who was so kind to say, Jeff, I'm not going to take away from yours tonight. And I said, well, we can't leave. We can't have you leave without having some kind of recognition. So we're going to add that to the front end of the March 15th meeting, if that's okay.
Yeah, and I would just, Greg, may I add something here?
Yes, ma'am.
I just, we have all worked hard. All of the directors have worked really hard to look at what's a realistic transition, what's a reasonable transition. The acting director supporting our staff, really being able to phase and stage transition in a way that's most supportive of our incredibly, as you've heard tonight, hardworking staff. And it's been a privilege to work in this environment, to work at Boulder County Public Health, and to have especially the opportunities to drive policy and strategy work with our staff and the community. So thank you.
Okay, well, we will definitely look forward to the beginning of the March 15th meeting, Susan.
It's actually
Yeah,
8.
I think, you know, it's not unnatural for, you know, various multiple leadership positions to change when you have a change as big as this one. I don't recall, how many years have you been with BCPH, Susan?
I've been with BCPH 6, and before that, 5 at the State Health Department in policy work.
Okay. Well, anyway, you know, I wish you nothing but health and happiness in your retirement. And thank you for those 6 awesome years. It was always a pleasure to see you and hear your insights on a lot of just kind of, you know, strategic initiatives, right? I mean, that was kind of a new thing when you came in. And so you just always have really good insights and present information in a fun and understandable way. So thank you.
Thanks. And I think just one more thing, the bench, the power, the capacity of public health. I think COVID, with all we've been through, it's tested us, but a new generation of leaders that are really battle tested, if you will, and ready to serve this community in ways that are even more nimble and creative. So I'm excited to see what happens. Thanks.
Okay.
Hey, Tammy, I think I gave the wrong date too. Maybe for the record, you could just make sure I've got the right date.
Yeah, it's March 8th. March 8th instead of the
Oh, I
15th.
meant for when we would do Susan's acknowledgement.
I mean, yeah, that would be April 12th, I believe.
12.
Yeah.
No, Susan will be gone by then on a vacation, so we were hoping to add it to the front end of your executive session before you go into executive session.
Oh,
Is
on
that
March
possible
17th.
to do that?
Yeah, I'll be in Utah actually on the 12th.
Okay, March 17th, then we'll add that at the beginning. So we'll have a special meeting. We'll start with a special meeting and do that, and then we'll move into executive session.
Thank you. I appreciate that, and I appreciate so much Susan. Again, she's looking out for me, saying, you know, I'm not going to take away from yours, and there's no way we can have Susan leave without having her get the right recognition. She's done so much for our organization, and we'll make sure we take care of that on that date.
Okay, well, we will save our accolades all up until then. Is that it for any announcements? Okay. All right, so now we are going to adjourn into executive session
Well, we
pursuant.
do need a motion, an official motion to do so.
Oh, okay.
And it has to state the,
Take it away.
This is Morgan. I move to adjourn the meeting and move into the executive session pursuant, is this what I say, Tammy? Pursuant to Colorado Revised Statutes 24-6-402 4F for purposes of discussing and conducting the public health director recruitment process.
yes, thank you.
This is Brooke, I second.
Okay, motion and a second. All in favor? Aye.
Aye.
Okay, everyone, thank you for your patience. Long meeting, but a good meeting. And can we agree to take a 5-minute break before we get back on for executive session? Okay,
Yes.
take a 5-minute break, get a drink, do whatever you gotta
And then
do.
you need to make sure you log into that other meeting. So log out of this one and log into the other.
Yes.
Okay,
Okay.
great. Thank you.
Okay, thank you very much.
Bye.